My name is Dr. Waqar. I'm working as professor of cardiology. Today I'm going to discuss few general things about the blood pressure, high blood pressure. What is high blood pressure? What is blood pressure? Blood pressure is actually the pressure of the vessels and their wall on the blood. So it depends upon the elasticity in the vessel walls, blood vessels, and their hardening, so that causes the effect on the blood, and it causes the pressure on the that causes blood pressure. The normal blood pressure is 120 or 80. 120 is the systolic and 80 is the diastolic. The upper one is the systolic and lower one is the diastolic blood pressure. There are many instruments available in the market which measures the blood pressure. So 120 and 80 is normal. If it increases, we call it high blood pressure or hypertension. Use mercury, if possible, mercury blood pressure instrument. Otherwise, nowadays there are a lot of electronic gadgets are available. These cannot be very helpful, but there may be some issues with the accuracy. I will show you another video sometime in which I will show you how to accurately measure the blood pressure from the digitals as well as from the mercury as well. So this is important. So upper blood pressure is systolic and lower is diastolic. There are different stages of blood pressure. Stage 1 and stage 2 blood pressure, the most common. Stage 1 is a blood pressure where the blood pressure is high, but it is lower than 160 systolic and 100 diastolic. So it is below 160 100. This is stage 1. When the blood pressure rises above that 160 and 100, it is right above them. That is called stage 2 blood pressure. There are very misconceptions that people say that there are symptoms of blood pressure. All the time there are symptoms. Not always. This is not true. Sometimes there is no symptom at all and the blood pressure is high. We check in our clinics, the patient got high blood pressure but they don't have any symptoms. But the symptoms are also there. In some of the patients they don't feel symptoms, some of them feel the symptoms. So what are the common symptoms? The most common is the headache, pain in the neck and the shoulders, pain, spasm of the muscles, this pain like that, pain in the left arm, palpitations, sometimes shortness of breath, rare palpitation is common as well. Sometimes epistaxis, bleeding from the nose. There are many other symptoms as well. Increased frequency of urination is one of the common features. So, but these features and these symptoms, may be present in other diseases as well. So, if you find any of these symptoms in yourself, you need to check your blood pressure a few times and go to the doctor and discuss with him. Doctor will tell you that you have got a high blood pressure or not. If you have got high blood pressure, then you need to treat it according to the doctor's advice. Take the medicines and the lifestyle changes. High blood pressure in the acute form, immediately in emergency, or in the chronic form can lead to different complications and have got bad effects on the different organs of the body. The most common, the most vital organs are brain, eyes, heart and kidneys. It can cause different degrees and levels of blindness. It can cause different levels of paralysis or stroke. It can damage the kidneys, dysfunction. It can cause heart attack. It can cause the hypertrophy of the heart muscles. Heart muscles become thick. They can have different symptoms and complications later on. These are called the target organ damage by the high blood pressure. There are other effects as well on the other parts of the body as well, but these are the most important and the vital one. So it is important that you should check the blood pressure. You know, it's very important to check the blood pressure, not only the symptoms. If you don't have the symptom, even then you check. That's why it's called a silent killer, because it kills the patient. Sometimes, not always. Don't be afraid. Don't get scared. This is a reason, because I want to make careful everyone that high blood pressure can cause fatal changes in the bodies. They can be without symptoms sometimes. So, in addition to medications and treatment advised by the doctor, you should also change your lifestyle. The most important changes in the lifestyle are the dietary changes as well as sedentary changes in the lifestyle. In the diet, the most important one, first of all, is the salt. Reduce the salt. Don't add extra salt in the food. Sometimes people add salt in some drinks as well, and some in juices, in some fruits. Don't do that. That is very dangerous. Rather, if you are using salt in the cooking, so reduce that as well, as much as possible. So, thus, reducing the salt will definitely reduce the blood pressure levels. So, salt restriction will be advised in other heart conditions as well. So, this is not good. So, reduce the salt is important. Second, the most important thing, after the salt, is the reduction in the weight. Nowadays, people have got sedentary lifestyle and people are having the junk food and they don't have the time due to their busy lifestyle and busy schedules. So it's important to reduce the weight. Stop the carbohydrates completely to reduce the weight. Carbohydrates, you must be aware. If not, I could tell you a few things that like rice, sugar, or sugar-made things like candies, biscuits, or anything in which sugar is added, and bread as well, and some of the fruits like bananas, mangoes, and or grapes with high contents of sugar. So stop those things. When you stop the carbohydrates, you will reduce your weight significantly. But you have to do the regular exercise and walk as well. Brisk walk. Start the walk regularly at low pace, then gradually increase it. Go up to 45 minutes to 1 hour per day, or maybe twice a day. This regular walk, brisk walk, will not only reduce your weight but also your blood pressure, and then you will feel more energetic, more younger, more fresh. This regular walk can also increase the better muscle mass and satisfaction in that. You're increasing the circulation levels. So this is important. If you are diabetic, then you need to be more careful. Diabetes multiplies the risk factors of developing different complications in the presence of all these things. Stop smoking. Control blood pressure. Control your cholesterol levels, weight, regular exercise. This is very important. Smoking, smoking kills. Why it kills? Because it causes breach in the lining of the vessel walls, and then different chemicals got deposited there. Vessels become more hard, causing more pressure on the blood, so higher in the blood pressure. So it's important to reduce the smoking, stop smoking, reduce weight, and dietary changes. Nowadays, there are a lot of stresses, mental, physical stresses people are getting. So this tension. When you do regular exercise, these stresses and tension cannot affect your body, cannot affect the blood pressure. It has got less effect on that. So again, exercise is important. Go to the doctor, get your checkup, get the advice on the lifestyle changes, and in addition to that, it's important to have more better dietary changes. Fruit, get more fruit, more vegetables, fresh fruits. So I wish you good luck and your health future. Enjoy your life, enjoy your healthy life. Modify your lifestyle, improve your lifestyle. Thank you very much. See you next time in another video.